I like to tell people that when we think about bias, it's not a yes or no, it's a continuum. It's a continuum of like infrequent to frequent, right? And so if we don't have the kinds of training data that help to guide the way that we might build, right, a new tool of sorts, then we're building it for certain groups of people, or we're building it based on this theoretical norm that isn't actually a norm for most people. And so that's why bias really matters, right? Your ability to understand that it is going to be present and that you build systems and mechanisms to mitigate it. But I think what I hear a lot of clinicians talk about is like their worries about AI, right? And like really focused on the bias aspect. And that's something super important that we all should consider. But what I would also, make clear is that bias is in a lot of our practices, right? So even our DSM has a lot of bias, right? So the most basic way that we think about mental health disorder and whether folks are going to actually qualify as having depression or PTSD or something different. But bias is everywhere. It's not about whether or not it's there. It's about understanding that it's there, and then doing your best to mitigate it as much as possible.